Good morning and welcome to the 2019 Bluegrass Dining Out for Life News Conference. My name is Dan Kett, and on behalf of the wonderful agencies represented here today, we'd like to thank all of you for coming out in support of Dining Out for Life. With that said, it gives me great pleasure to bring up the Executive Director of Avol, Kentucky, ladies and gentlemen, Mr. John Parker.
Wow. Thank you so much for everybody who's here today. I just want to shout out to our restaurants and our sponsors for Dining Out for Life this year. I really appreciate you being here. It's going to be an exciting couple weeks. Avol is kicking off our 10th annual Dining Out for Life in support of HIV prevention, testing for those at risk, and for the provision of housing and support services for citizens in our community living with HIV. And for our collective efforts to end HIV in Kentucky for good. Isn't it about time?
Yes.
Today we want to share that anyone in our community can dine out at any of our 56 very generous restaurant partners all day on Thursday, September 12th, and 25% of your bill will be donated to Avol and the fight to end HIV. So we're going to eat. We're going to eat some more, breakfast, lunch, dinner, after dinner. You don't need a coupon or you don't have to say a secret password in order for it to count. Just show up and dine. We are so grateful to our local restaurant partners, and I know that Lexingtonians like to eat, so we've made giving very easy for you. So Avol, Kentucky is very grateful to have Lexington Fayette Urban County Government as an advocate and partner at our side. For the better part of 30 years, LFUCG has held up and supported Avol as we've continued to seek solutions to the HIV/AIDS crisis in our community, and for their unwavering care for those who need our help most. I would like to personally thank Mayor Linda Gordon, our mayor, and her staff for opening these doors today for this very special kickoff. Please welcome your mayor, Linda Gordon.
Thank you so much, John. Welcome, everybody. And thank you so much for being here. I think what John means is we're eating out breakfast, lunch, and dinner, right?
And then some.
And then some. Avol has been a critically important organization in our community for over 30 years. And the city has been a committed partner with Avol to help those living with HIV/AIDS, whether with medical testing, housing and prevention tools, education. Ever since HIV/AIDS crisis hit our community in the 1980s, we've been fortunate to have organizations like Avol committed to helping those affected by the virus. We still have work to do, of course. However, with decades of research and education, there are new tools to better prevent the spread of HIV/AIDS. As a registered nurse, I totally understand the importance of this research and how one day, we hope to completely end transmission of this disease. I am thrilled to join John, Avol staff, and numerous volunteers for the upcoming Dining Out for Life event happening all across the city. It is a wonderful event. Having participated in the eating in the past, I can attest to how wonderful it is. Since 2009, this event has been successful in providing education to the public while also raising funds for the very important work of Avol. I'm looking forward to having a great meal at one of the 56 participating restaurants on September 12th and supporting the work of Avol. I hope you will join us and Dine Out for Life on September the 12th. So thank you very much, and I want to give a special thanks to AVOL for the work you provide in our community. Thank you so much. Thank you.
Thank you, Mayor Gordon. Never before since we began our work in 1987 has the science and resources available to us been so effective. We now know that people living with extremely low levels of HIV have relatively zero chance of passing the virus along to others. This viral suppression involves many factors, most of which is that persons living with HIV remain engaged in medical care and medication adherence. AVOL's housing and support services and empowerment services have proven to reinforce adherence, leading to this viral suppression. And if you missed it, let me emphasize, relatively zero chance of passing the virus along to others. This is amazing. The Office of Grants and Special Programs is the administrator of many of AVOL's housing programs. Miracles happen through these programs, which allow safe and affordable housing opportunities for people living with HIV, whether that be in mainstream rental housing or in partnership with a number of different providers, or at Solomon House, a community residence for folks who have more extensive medical issues. The Grants and Special Programs Director, Charlie Lanter, and his staff, Cindra, Jeffrey, Theresa, and Stacy, take really good care of AVOL. I'm really happy to introduce my good friend to you, Charlie Lanter.
Thanks, everyone. AVOL works alongside the City of Lexington, and we together administer federal HOPWA funding, which is housing opportunities for persons with AIDS. We have been partnering together on this for a very long time. Our work goes back to 1995 when we first started working together on planning for the Rainbow House and Solomon House. Rainbow House opened in '96, Solomon House in 1997. We have made significant changes, as John mentioned, since those early years, when people who were living in those facilities were not expected to live very long. And now, not only do those folks get better, but they thrive, and they move on to permanent housing. And it's this partnership with your local government and with AVOL that makes that possible and makes that successful. Make no mistake, housing is healthcare. I'll say that again, housing is healthcare. It is critical. And a critical component of the work we do together. We can see how stable, affordable housing opportunities change lives and improve health. AVOL Kentucky has worked to lead this community forward, providing direction not only in preventing the further spread of HIV, but also creating these affordable, stable living environments for people who are medically fragile. On a personal note, and I asked John if I should be a little offended that I got invited to the press conference about eating. It turns out this is something I'm very good at. And this is one of my favorite events of the year. I really enjoy it. How could it be any easier to support the important work of an important organization than to just go out to lunch with friends and breakfast and dinner and maybe a late night snack too. So I hope to see you all out on September 12th. And if you need someone to go to lunch with, I'm available. Thanks.
All right, Charlie.
Thank you, Charlie. Thank you so much. We really appreciate Charlie and his team. I want to talk for a minute about PrEP, which stands for pre-exposure prophylaxis. This is an effective once-daily pill taken to prevent the transmission of HIV. Few have heard about it, but it is becoming more and more accessible. With new resources like PrEP, along with traditional tried and true approaches like increasing access to testing, advocating the use of various prevention supplies, education, reducing barriers, and raising awareness, we can reduce the number of HIV infections overall. AVOL gets people connected to this PrEP every day. One of our dedicated partners in prevention is the Lexington Fayette County Health Department. AVOL is there every Wednesday assisting with the operation of their needle exchange program. And I'd like to give a shout out to the Health Department and recognize Kelsey Hernandez, who is here with us today. Thank you for all that you do. AVOL's prevention team is out in the community every week providing HIV testing in our mobile testing unit. This is a van that Elton John bought us. I still haven't met Elton John yet, but we're really grateful for the van. Right?
Bring him on.
HIV test results take 1 minute to get the results, and early detection is key so we can get folks connected to care if they test positive. I'm always impressed by the leadership provided by Chris Ford, our Commissioner for Social Services, and his staff, Teresa Maynard and Larry Collins, who make sure that AVOL has what it needs to keep the van rolling and testing at the needle exchange going. In collaboration with our state and Centers for Disease Control grants, and our state folks are here today, thank you for being here. The local investment for prevention through the Extended Services Resource Program has become so critical, and we are very appreciative. Folks, please welcome Commissioner of Social Services, Chris Ford.
Thank you, John, and good morning. I'm excited to join this event as we raise awareness for the important services that AVOL Kentucky provides for our community. We recognize and value the roles that community organizations across Lexington, human service networks play in empowering residents and enhancing quality of life. And as such, the Department of Social Services is fortunate to count AVOL as a key stakeholder and partner. Our long-standing partnership between AVOL Kentucky and Urban County government, as John mentioned, is via our Extended Social Resource Grant, commonly referred to as ESR. Our grant investment is leveraged by the generosity and the community support for AVOL's programs. This allows AVOL to navigate outreach and connect high-risk individuals at the community level, at the ground level, and it is critical in getting more of our citizens' vital health information. We know engagement of people at risk and early detection of HIV is key in stopping the spread of the virus, since immediate medical care can now more easily be accessed. AVOL Kentucky has the ability to lead this community forward and has demonstrated such by providing the direction not only in preventing the further spread of HIV, but also finding better ways to navigate and connect high-risk individuals to medical care. In closing, I express our support for AVOL, for John and his staff, your board of directors, for your leadership. We thank you for allowing us this invitation and opportunity to engage and support your impactful community service, and we hope everyone enjoys Dining Out for Life. Thank you and congratulations.
Thank you so much, Chris. It all starts with an HIV test. AVOL provides testing for free, but you can also access testing at the health department, your medical provider. You can even access a test at your local pharmacy over the counter. For more information, contact AVOL via our website at avolky.org. So as you can see, there's a lot of great work happening between AVOL, Kentucky, and Lexington Fayette Urban County government. I have never been more optimistic that we might just get a shot at getting ahead of this thing. And we believe that together we have put HIV on notice. Its days are numbered. And the investment becomes even greater by our entire community participating in Dining Out for Life on Thursday, September 12th. Last year, Dining Out for Life raised over $110,000 in valuable resources. We actually entered the top 10 Dining Out for Life events in all of North America. It is a great honor. And it's so easy to give. Just dine out on September 12th. Dining Out for Life is our local investment that changes lives. Please plan to be a part of it. All the information about Dining Out for Life can be found at dineoutlex.com. I wanted to give a shout out to Woodford Reserve, our presenting sponsor, and Advantage Air HVAC, Aval, Kentucky's 2019 legacy sponsor. There's a lot of restaurants to mention, but we have several of them here today, and we're so appreciative to our restaurant partners. Raise your hands if you're a restaurant partner. Excellent. Good to see you all. Thank you. Let's also hear it for Aval's dedicated staff, our volunteers, and our amazing board members. Our president, Michael Burchett, is here. Michael, good to see you. Staff, raise your hands. Hello. Thank you all so much for the wonderful work that you do. And together, we're going to make this amazing event happen on Thursday, September 12th. Do you have any questions for myself or anyone on the stage? We will stick around after the press conference for individual conversations if you would like to have those. Thank you again, Mayor Gordon, Chris, Charlie, Urban County Council members and staff. Your partnership is important to us. Everyone, please dine and support Aval, Kentucky on September 12th. And we're going to do a really fun closing. We have our new aprons that every one of our volunteers wears in the restaurants, and we're going to put these on. And I'm going to ask for any volunteers, staff, restaurant folks, Judge Reynolds, Priscilla, come on up here. We're going to do a shout out and tell everybody to dine out for life. So come on up here really quick. We'll get aprons and everything.
I've worn one of these before.
Yes,
Only it
yes.
was red. It was red.
Changed them this
Oh,
year.
yeah.
For the first time ever.
Sweet.
Yay.
Thanks, Judge.
That is the new logo, that's right.
All right.
This is the first one.
Let's get up on these steps.
I like it. I like it.
Great picture. Can you get yours done?
Okay, let's
Get in
mobilize
front of the
quickly.
podium.
Yes, okay, in front of the podium. So everybody, on three, we're gonna everybody jump. On three, we're gonna shout, "Dine out for life," raise a glass, do jazz hands, do thumbs up, cover your face, whatever you want to do, be animated and excited and enthusiastic. We're gonna do a practice round. Remember, it's on three, so it's 1, 2, dine out for life, and then we'll do the practice, and then we'll do the real deal. 1, 2,
Dine out for life!
okay, that was just the practice. So let's do one more for the tank. Cameras rolling. Ready? Is everybody ready?
Yes.
Dine